Shockwave therapy is a promising addition to the treatment options for men with erectile dysfunction. There are many questions about shockwave therapy that need answering before you consider it as an option for your erectile dysfunction problem. In this video, I will answer the top 12 questions that men have been asking about shockwave therapy, and if it's right for them. Before deciding on shockwave therapy as an option, it's important to weigh the pros and cons of all available treatment methods, so you can make a decision based on what will work best for your situation and lifestyle. There is a link below this video to a playlist of videos exploring different aspects of wave therapy for erectile dysfunction. These videos include a general description of wave therapy, cost associated with shockwave therapy, plus a number of other topics. If you have any questions about this video, just call or text Healthy at 60+ at 609-410-4790. Now let's see what we have today. Question 1. What is shockwave therapy? Shockwave therapy is a form of medical treatment produced by an electronic device and directed to the area of injury. The waves can break up scar tissue that has formed in damaged or diseased areas, which allows for better blood flow to speed up the healing process. It's been used on patients with chronic pain from conditions like herniated discs, plantar fasciitis, tennis elbow, and more. It also helps reduce inflammation to relieve symptoms associated with rheumatoid arthritis and other inflammatory joint diseases. Question 2. How does the procedure work for erectile dysfunction? Shockwave therapy, also known as high-intensity focused ultrasound, has been shown to help with erectile dysfunction when it is caused by damage to the tissue in the penis. Shockwave therapy is a minimally invasive treatment for erectile dysfunction. Shockwaves are generated by an energy source, electrode, and delivered to the targeted area through an applicator that cause microtrauma in the soft tissue, which leads to new blood flow into the region. This process helps produce more nitric oxide, which relaxes smooth muscles and increases blood supply, and as a result, erection becomes easier and stronger. Question 3. What are the benefits of shockwave therapy? Erectile dysfunction is a common problem, especially as men age. Erectile dysfunction can make it difficult to have sex and sustain an erection. There are many treatments available, but none of them work for everyone. Some options include pills, injections, surgery, or vacuum devices that help draw blood into the penis, causing an erection. However, these solutions often don't provide long-term relief from erectile dysfunction symptoms, or improve sexual performance in all situations. Shockwave therapy may be able to restore your ability to achieve and maintain an erection by increasing blood flow to the penis when other treatments fail or aren't appropriate. This treatment has been shown effective in helping men with diabetes, who have nerve damage related to poor circulation. Shockwave therapy could also be used as a preventative measure against erectile dysfunction before circulation problems occur due to conditions like diabetes or high cholesterol levels. Question 4. Who can be treated with shockwave therapy for erectile dysfunction? Shockwave therapy has been shown to be an effective treatment for erectile dysfunction, and the nearly 50% of men that struggle with erections may find relief. However, this type of treatment does not work for everyone. The best candidates are men who suffer from mild to moderate erectile dysfunction that is caused by arterial insufficiency or venous leakage into the penis during an erection. A man's age may also play a role in whether shockwave therapy will work for him or not, but younger men tend to respond better than older ones do. Question 5. What are some side effects of shockwave therapy? The side effects of shockwave therapy are typically mild and temporary, though some experience more discomfort than others. Some side effects include mild to moderate pain during the treatment session, swelling at the site of treatment, bruise or discoloration where the wand was placed on the genitals, numbness or tingling in the treated area, painful erection, especially during sexual intercourse, blood in the urine. Question 6. How long until I see positive results? After a shockwave session, you can expect to notice some improvements in the overall health of your genitals. Studies have shown that low-energy shockwave therapy can improve the response to oral medicines for erectile dysfunction, and provide some return of spontaneous erections by increasing blood flow to the penis. Question 7. How long will the positive results last? It is generally recommended to have a treatment series every 2 years. However, men with diabetes probably need a treatment series every year. Question 8. How much does the treatments cost? The popular Gainswave therapy for erectile dysfunction typically costs around $500 per session. Other forms of wave therapy cost between $350 and $600 per session. It typically takes 6 sessions to complete a treatment series. So expect to pay between $1,800 and $3,500 for a treatment series. And as stated before, expect to need a treatment series every year or two. Question 9. Does insurance cover the cost of this treatment option? Shockwave therapy is a type of treatment that has been used for years to treat men with erectile dysfunction. Though it's not covered by insurance, many men have found it to be an effective and cost-effective way to maintain their sex lives. Question 10. Is shockwave therapy guaranteed? There are some clinics that will offer continued treatment at reduced or no cost if the results are not satisfactory. There does not seem to be any clinic that will offer a money-back guarantee if you are not satisfied with the results. Question 11. Can I buy a machine for home use? Yes, there are a number of medical supply houses that sell shockwave therapy machines to the public. As in all things, it seems you get what you pay for. Machines are priced anywhere from $100 to several $1,000s. An average price seems to be around $900. Question 12. Can I take erectile dysfunction medication with shockwave therapy? In the past, it was not recommended that erectile dysfunction medication be taken with shockwave therapy. Newer research has shown that men can take these medications safely and still see results from their treatment. There are some side effects to watch out for when taking these medications at the same time as shockwave therapy, such as a headache or dizziness. These effects should only last a short while and then go away if you stop taking the erectile dysfunction medication. In conclusion, have you ever tried shockwave therapy for erectile dysfunction? If you have, I have a question for you. In the comments section below this video, can you take a moment and leave an answer to any of the following questions? 1. Did the treatment work for you? 2. How long did the positive results last? 3. What were your side effects, if any? 4. If you didn't like the therapy, what could be a good alternative to this type of procedure? 5. Is there any other advice or information that would be of help to men considering shockwave therapy? Okay, that's it for this video. But just one more thing. If you have any questions about this video, just call or text Healthy at 60+ at 609-410-4790. Remember, there are many ways to deal with erectile dysfunction. Shockwave therapy in a doctor's office is one of them. If you are interested in a home device for shockwave therapy, then click the link below this video for a safe and cost-effective device. To be informed of new videos, just subscribe to this channel and remember to click the bell icon. To view other videos about men's sexual health, just click on either of these 2 video links. Thank you for stopping by and watching this video. Remember to contact me with any questions. Have a great day, and here's to your good health.